Hello and welcome. Today I'm here with Dr. Christian Lanphere to talk about Massachusetts preparedness when it comes to outbreaks of deadly diseases like Ebola. Thank you so much for joining us.
Thank you.
So we'll get right to it. Ebola and Massachusetts, how prepared are we as a state to deal with any sort of outbreak?
So I think that Massachusetts, and I think we need to go back, probably 6 or 7 or 8 years, where even after September 11th, the state, and I think along with my colleagues across the country, we've been preparing for all hazard events. So biological, chemical, radiological type, and explosive type events. So I think we've been, over the years, we've been gearing up for these types of events to unfold. Now that Ebola has really come on our shores, I think that there's a big sense of panic. But I think that we've actually come a long way.
Okay, and say hypothetically someone is suspected of having Ebola, contracting Ebola. Could you walk us through the procedures of what would be done as emergency and quick precautions?
Because flu season's coming up, so I think this is something that we really need to be mostly concerned about. For patients or people who are really concerned that if they had a recent travel to West Africa, or they may know someone who recently traveled to West Africa, and they start to develop flu-like symptoms, I would immediately get on the phone and start calling your doctor. Depending on the facility, all of the primary care doctors' offices now are all going through a triage algorithm. They're really they want to find out what exactly your symptoms are, and then if any recent travel to West Africa. If there is some type of travel, they will then alert the emergency department, and they will encourage you to go to your local emergency department. And you can walk into any emergency department in Massachusetts, and I'm confident that all of our emergency departments now are getting much better prepared to handle this type of event. Most emergency departments around Massachusetts now are really defining who can interact with a patient. At the Cambridge Health Alliance, we're only allowing nurses and doctors. So we're not allowing any of the residents, any medical students, any physician assistants, any other ancillary personnel to come into contact with this patient. We want to dramatically reduce the exposure anyone might have with a patient who's suspected with EVD. So what we would do then is we would have our personnel get into personal protective equipment that sufficiently protects them from head to toe, no skin showing. They will go in, they will do a diagnostic screening with the patient, they'll do a recent travel history, and they'll try to manage any life-threatening events that may be occurring with that patient. If there is a high index of suspicion with this patient, we would then transport this patient to one of our hospitals in Boston, who are much better to manage this. And as of last week, Massachusetts designated 6 hospitals in Boston to be the Ebola centers, which are really focused on defining and managing aggressive therapy for these patients.
How can we inform public without spreading any sort of panic, but just to keep them informed on how prepared we are, or in case of any emergency, like what must we do?
The important thing is that not to quickly rush too much about information. You're not going to get Ebola from sitting next to someone on a train. And I think, this is the term I've heard a lot lately is, this is now the AIDS epidemic all over again. The way people are being treated was the same way that patients who look like that they may have had AIDS were treated back in the 80s. And so we want to make sure that we really are not, that we're not targeting certain individuals who may look like they're African. So we want to make sure that regardless of where you may come from, we want to make sure that people are not being singled out and are being treated like someone having Ebola when they've never even visited, they've never even left the United States. We want to make sure that everyone's being given the same opportunities.
We would like to thank Dr. Lanphere for sharing his insights with us about our state's preparedness to confront outbreaks of diseases. We hope that you have found our conversation to be helpful in providing perspective on this important issue. For Arlington Public News, I'm Akriti Jagmohan. Thanks for joining us.